my 2 minutes of time with you is to highlight a few things that the new small animal hospital will bring to enhance the client experience, but also the pet experience or the patient experience as well. There's been a lot of thoughtful hours put into the new design of the small animal hospital, and hopefully the outcome is an experience that not only makes the time period that the clients spend in our hospital better, but also reduces the stress for their pets when they enter our hospital, because as we know, every veterinary visit has the opportunity to be a stressful period of time for pets, and especially when they're ill. So we want to strive to be the absolute best that we can from the moment they walk into the door. So the few things that I want to bring to your attention, Dean Reed's already highlighted this through one of the videos that was just shown, but for the first time since I've been a member of the Veterinary Teaching Hospital, which has been for over 20 years, there will actually be a separate emergency room from the specialty hospital. Dr. Paula Johnson will spend some time with you to tell you specifically all the new things that the emergency center will bring to the college and to the teaching hospital, but it's exciting to be able to have a dedicated space for the emergency service. Another simple enhancement of the client experience is an increase in the number of exam rooms. As many of you know, since you bring your pets to Purdue Veterinary Teaching Hospital, there are currently only about a dozen exam rooms in the small animal hospital, and with our current caseload, that's just not enough. So simply by increasing the number of exam rooms, and again with the video that you just saw, you saw that there are more exam rooms. So hopefully the challenges we currently experience with our daily workflow and the inefficiencies of having limited exam rooms will be part of early 2020 and starting in 2022 and moving forward. Our ability to move an exam and a conversation quickly will be improved. The other thing that we put a lot of time in trying to determine what is the best design to help reduce the stress of the pets in the room, and with the help of our behavior team, we created designs where there's pods, and you saw that again in the video that was just seen. And so the seating arrangement of the pods not only allows a family unit to be together and be able to experience that visit as a unit, but there'll also be noise reducing dividers between each pod. As we have moved forward with technology, we also want to make sure that technology can come with each client, and so each pod will be equipped to handle the world of modern technology. And what this means is that there will be multiple electrical outlets, so keeping a personal device charged won't be a challenge. There will also be work areas to use for laptops as well. So again, we're trying to think about, we understand that people spend a lot of time in our waiting room as a specialty hospital, and so we want to make sure that time is productive. And then, because as I just mentioned, we do recognize that clients spend more time in our waiting room than they would with their general practitioner, we also want to make sure that we have a way for them to remain hydrated. So part of the small animal hospital enhancement will be a beverage bar with the goal to provide access to water and coffee for clients who are in our waiting room. Details still need to be worked out, but that is definitely one of our goals. As Sai mentioned during his video, there will be a walkway between the new hospital and the current hospital as well, because clients may need to move back and forth between both small animal hospital buildings, and while we live in the great state of Indiana, we recognize that the weather may not always be as great. So we wanted to provide a covered walkway to protect both the client and the pet from the elements. And then I just want to conclude by talking a little bit specifically about our feline pets. I am a feline fan. I'm also a dog lover as well, but really am a strong feline advocate. And so we spent a lot of time thinking about a waiting room design that would help reduce the stress when a cat comes to visit us. And we also spent quite a bit of discussion and design time to make sure that if a cat has to spend time in our hospital beyond the waiting room, that it also is as stress-free as it can be. So specifically what I mean about that is that one part of the waiting room will be dedicated as feline only. So the waiting room will only have cats, and there will be a design of that specific waiting room which will limit the ability for one cat to be able to see and interact with another cat. So we know that that will reduce their stress. And then the exam rooms will be for cats only. And that's an important thing because as we've learned over the decades more about feline behavior, we know that even the smell of a dog in an exam room can increase the fearful nature of the cat. And so these will be cat-only exam rooms to, once again, to reduce the overall stress of the cat in the exam room and the waiting room. And as I mentioned, if a cat has to spend the night with us, the feline ward has been designed with the most current knowledge of feline behavior as well. The walls are soundproof. The cage designs recognizes the special needs or the specific needs to a cat. Not that they're special needs, but they're specific needs. And then there's actually an exam room in the feline ward, so a cat patient never has to know that there's a dog on the other side of the wall. So these are just a few of the things that we have done and spent time actually thinking about to try to make both the client experience and the pet experience better with the new hospital. And again, I greatly appreciate all that you have done as donors to help us achieve that goal.